COVID-19 pandemic, also known as the coronavirus pandemic, is a type of disease that is a global pandemic where it can spread person to person. Breathing in air when close to an infected person who is exhaling that can land into eyes, nose, and mouth. Examples: sneezing and coughing. COVID-19 is an infectious disease caused by SARS-CoV-2 virus. Coronavirus is a big family of different viruses that can cause illness such as common cold. The virus was first detected in Wuhan, China in late 2019. Experts say SARS-CoV-2 originated in bats. That's also how the coronavirus behind Middle East Respiratory Syndrome or MERS and Severe Acute Respiratory Syndrome or the SARS gets started. Since COVID-19 pandemic starts, the number of cases have already reached millions worldwide at the end of the 2020 up until now. Philippines have the number of cases that is alarming. As countries around the world face the continuing threat of COVID-19 pandemic, national governments and health ministries formulate a way to help. Early health measures were primarily aimed at preventing and reducing transmission of populations and risk. COVID-19 pandemic resulted severe economic and social impacts around the world. Young people are particularly vulnerable to the disruptions the pandemic has caused, and many are now at risk of being left behind in education, economic opportunities, and health and well-being during a crucial stage of their life develop. Both the national government and local governments have responded to the COVID-19 pandemic in the Philippines with various declarations of emergency, closure of schools and public meeting places, lockdowns, and other restrictions intended to slow the progression of the virus. To prevent the spread of the COVID-19 pandemic, the government kept reminding the Filipinos people to follow the health and safety protocols and implemented lockdown and community quarantine in major parts of the country. The children are not allowed to go out because they are vulnerable to the virus. The negative impacts of COVID-19 to Filipino families are fear, pressure, and problems. The positive impacts of COVID-19 to Filipino families that they had more time to talk and create happy memories together, and the working parents have a chance to bond with their children and give them the opportunity to build a strong relationship to their loved ones. Based on the research that the students conducted, it says that half of the total population were satisfied of their reasons that the government did their best to monitor and prevent the spreading of virus. Second, they implement some health protocols, locked down certain municipalities, gave ayuda, and offer free vaccinations to everyone. However, the other half of the total population were not satisfied due to late response of the government banning of flight from China to enter our country. Shortcomings and health care were being ignored that time, which began to spread and increase the number of acts. One netizen said, "If I were in charge of the government, I would prioritize the issues and establish a plan to protect my people from the COVID-19 epidemic by preventing rather than curing it." Other response from a netizen says, "If I were to be a government, I will prioritize to implement the vaccination program for all the citizens of the country, conducting a constant and clear orientations to every individual to be aware and to avoid doubts of the said vaccine." Here is the other response from a netizen says, "If I were to be the government, I will impose strict rules on them for wearing masks in public places and insisting that they maintain their social distance at all times.